Despite closing the borders with most other states and territories, the threat of COVID-19 coming ashore remains in Western Australia. Another ship with COVID-positive crew members on board and a growing outbreak over east has put the state on edge.
It is a problem. It is a problem. We're going to have to look at what we do about this. So obviously that's an examination we're currently going through.
But for months now, serious concerns have been raised about the state of Western Australia's hospital system.
Perth's health system is at breaking point with a COVID.
And its ability to cope with a COVID outbreak.
To be honest, most departments are running at almost disaster level, at least several times a week. Everyone's feeling exhausted and burnt out, and we haven't had a COVID outbreak in WA, and it kind of frightens me to think how our staff would cope if we did.
Dr Peter Alali is an emergency physician and is the WA Faculty Chair for the Australasian College for Emergency Medicine. He told 7:30 the system is running at a dangerous level, with code yellows or internal disasters being called frequently.
To have it for overcrowding in the 21st century in one of the richest countries in the world is scandalous, to be honest. It's a fixable problem.
WA ambulances spent more than 5,000 hours waiting to unload patients at emergency departments last month. The state government has blamed the crisis on a combination of factors, including what it says is more mental health presentations.
Look, we are under a lot of pressure, and every health jurisdiction in Australia is feeling that pressure as well.
It's a system under pressure, and it's evident in the incident that happened to Aishwarya's family.
At Easter, 7-year-old Aishwarya Aswath died after waiting for 2 hours for emergency help at Perth Children's Hospital, prompting a fiery rally from outraged medical staff.
So we're looking at a number of ways that we can continue to make sure that we ease that pressure on our healthcare workers. Firstly, around a significant recruitment drive of nurses.
WA Health told 7:30 the system pressures are complex and there is an ongoing issue with hospitals caring for people who could be treated by a GP. Is WA's tough approach when it comes to lockdowns and hard borders a direct reflection on the hospital system?
No, we act on the basis of the health advice of the Chief Health Officer. But the best way we can support our hospital system during a pandemic is to control these outbreaks so we don't transfer that pressure onto the hospital systems themselves.
Next, please.
The department says plans have been made if there is an outbreak of COVID, including reducing elective surgeries. Curtin University infectious diseases expert Professor Archie Clements says as the pandemic drags on, it's likely WA will continue to use its isolation to its advantage, including lengthy border closures.
By and large, the economic impact in Western Australia hasn't been as devastating as elsewhere. I think that the tolerance for those types of strategies that continue to keep us isolated probably have greater longevity in a place like Western Australia than elsewhere.
But the hard border comes at a cost. WA resident Susan Dealey flew to New South Wales in late June to help her elderly mother move house after her partner died. By the time Susan landed, her exemption pass allowing her to return to Perth had been revoked.
I'm absolutely frustrated, and if I think about it too much, I get very anxious.
She's had to wait for 2 weeks in the ACT and is flying home via Darwin to avoid transiting through airports in states with outbreaks.
Surely a negative COVID test shows that I'm not a threat.
WA Police wouldn't tell 7:30 how many residents have been locked out of the state, but said anyone who had their G2G pass rejected can reapply with supporting evidence. After weeks of uncertainty, Susan Dealey has finally made it home to isolate for another 14 days.
It used to be a unified country, and that seems to be breaking up now. We're a wealthy country. Surely we can do this a bit better.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.